Hi there, welcome to Ask Dr. Amy. I'm Dr. Amy Fan. I'm a board-certified pediatrician and the founder of Kinder, the first and only all-online pediatric clinic that provides clinic-level care, well visits, sick visits, right in your home. So today we're going to talk about a concept called increased work of breathing. It's one of these buzzwords for pediatricians. And I want to talk about this because it can be hard to know as a parent, when does my child need to see a doctor, or when do we need to talk to a doctor? And it's hard to give you a complete list of all the signs. I would say you know your kid best and follow your instincts. But if I can come up with a list, this one would be at the top of my list. Whenever a child, really probably also an adult, but I haven't had an adult patient in many years, so I'm not going to say this. But for children, anytime they have an increased work of breathing, that's a sign that something is wrong, or at least they need an evaluation by a pediatrician to make sure they're not, going to progress in a bad way. Now, increased work of breathing is actually not specific to one illness. It can be a sign of many different things, from say pneumonia to a viral illness that's making the baby breathe too hard over a long time and they're tiring out, or even DKA and diabetes. So it's not important to decide what the cause is, but anytime you see increased work of breathing, that's why you need a pediatrician to really assess the whole situation and see what care or what workup is needed. So I want to talk about, at home, how you can quickly assess that your child has increased work of breathing. The first thing is, how many times per minute are they breathing? You can find this out by just putting your hand on their chest and, give yourself 30 seconds on the clock and just count how many times they're breathing. Because for babies, it can be quite fast and it can be hard to see. So I would encourage you to use your hand. And as for the actual number of times per minute, that really depends on the age. So I encourage you to talk to your pediatrician each time you see them and say, hey, for this age, what's the normal range of number of times they should breathe? For example, for a baby to breathe 40 times per minute, perfectly normal. But if your 10-year-old is doing that, that's not good. So find out for the age, and it really changes a lot as they get older. One caveat to this is, remember that everybody breathes faster when they have a fever. So when you're counting the number of breaths, I would treat the fever first and make sure their temperature is near normal when you count the breath. Because even if their lungs are okay and the breathing is okay, just because somebody has a fever, they will breathe faster. And then after that, is to look for signs of working hard to breathe. So from the bottom, when you're looking at a baby, usually their stomach goes in and out a lot with each breath compared to an adult. But for a baby with increased work, you will see their stomach going in and out with every breath, sucking in a lot more dramatically. As your eyes travel up, sometimes underneath the rib cage, you will see that it's sucking in with every breath. And in between the ribs, you can also see if something is moving dramatically with every breath, that is already a sign of increased work of breathing. You shouldn't see the ribs, pulling in between with the breath. And then if you go up further, sometimes you can see pulling in the neck where they're sucking in with every breath. You can see the muscles in the neck engaging. That is also increased work. And then, nostril flaring. If their nostrils are flaring with every breath, they're working hard to suck in the breath. Some babies might start head bobbing. Their head is moving with every breath. That's a sign that they're, working hard to get that air in. Or more dramatically, sometimes older kids will tripod. They'll, use their arms to get more of a stance on the bed or something so they can help themselves breathe more. That's more of a late sign. So as a parent, I think the most important thing is just to, in the back of your mind, if they have a cough or any kind of respiratory illness, or even if not, because remember, for DKA and diabetes, sometimes there's no respiratory symptom, just keep in the back of your mind to see if they're breathing harder than they should. And if that thought is in your head, then I would go ahead and count number of times, look for these specific signs. And looking for these signs also helps when you talk to a doctor, so they know what you're looking at. Now for our Kinder system, if I hear a kid has increased work of breathing, I would, hop on the video, look at them, how they breathe. From your toolkit, I would use the pulse ox to see how they're oxygenating in the blood. And with the history, we can really get a good idea pretty quickly about what's happening. But the danger is letting increased work of breathing go on for too long. It's hard to say what the outcome would be without knowing, because remember, it's unspecific. It can be many number of diseases. But letting it go on for too long can reach a point where the support might come too late. So you really want to, give them support, whether it's oxygen or more of a workup, or just finding out what is causing the increased work of breathing as soon as possible after you see it.